Have you ever felt extremely happy and energized for days, only to crash into a low, sad state? These emotional shifts can be confusing and overwhelming. These shifts in mood are common, but for some, these highs and lows are extreme and interfere with daily life. They can affect relationships, work, and overall well-being. This is bipolar disorder, a mental health condition that affects millions of people worldwide. It is characterized by significant mood swings that go beyond the typical ups and downs. It's like a roller coaster of emotions, with dramatic highs called mania, and deep lows called depression. During manic phases, individuals may feel invincible, while depressive phases can bring overwhelming sadness. Bipolar disorder is a serious condition, but it's important to remember that it's treatable. With the right combination of medication, therapy, and support, individuals can manage their symptoms effectively. With the right support and treatment, individuals with bipolar disorder can lead healthy and fulfilling lives. Small victories and consistent support can make a significant difference. Think of it like managing any other health condition like diabetes or heart disease. It requires ongoing attention and a proactive approach. It requires attention, care, and a plan to stay healthy. Regular check-ins with healthcare providers and sticking to a treatment plan are crucial. Just like we don't shy away from seeking help for physical health, we shouldn't hesitate with mental health. Reaching out for help is a sign of strength, not weakness. This essay aims to shed light on bipolar disorder, its symptoms, the impact it has on daily life, and most importantly, the path to recovery and well-being. Understanding the condition is the first step toward managing it. Knowledge is power, and understanding bipolar disorder is the first step toward removing the stigma and supporting those who live with it. Together, we can create a more compassionate and informed society. Bipolar disorder can manifest differently in each individual, but there are some common signs that can help in its identification. Recognizing these signs is crucial for early diagnosis and timely intervention. Imagine a person who is usually calm and collected suddenly becoming overly talkative, restless, and full of energy. They might take on multiple tasks at once, sleep less, and engage in risky behavior. This could be a sign of a manic episode, a hallmark of bipolar disorder. On the other hand, during depressive episodes, the same person might experience prolonged sadness, loss of interest in activities they once enjoyed, fatigue, and changes in sleep and appetite. These extreme shifts in mood, energy, and behavior can be confusing and distressing, both for the individual experiencing them and for their loved ones. It's important to remember that these symptoms can vary in intensity and duration. Some individuals might experience more intense manic episodes, while others might have more frequent depressive episodes. If you or someone you know is experiencing these symptoms, it is essential to reach out to a healthcare professional for a proper diagnosis and support. Bipolar disorder is not a one-size-fits-all condition. It presents itself in different forms, each with its own unique characteristics and challenges. Understanding these variations is crucial for tailoring treatment plans to individual needs, ensuring that each person receives the most effective care possible. Bipolar I disorder is characterized by at least one manic episode that lasts for at least a week or requires hospitalization, often accompanied by significant changes in energy, activity levels, and behavior. These manic episodes may be followed by hypomanic or major depressive episodes, which can be equally challenging and require careful management. Bipolar II disorder, on the other hand, involves a pattern of depressive episodes and hypomanic episodes, which are milder forms of mania, but still impactful. While the highs are not as extreme as in bipolar I, they can still disrupt daily life, making it difficult to maintain routines and responsibilities. Lastly, cyclothymic disorder involves periods of hypomanic symptoms alternating with periods of mild depressive symptoms, creating a persistent instability in mood. These symptoms last for at least 2 years in adults and 1 year in children and teenagers, often leading to significant emotional and social challenges. It is important to note that these are just broad categories, and there can be significant variation within each type, making personalized treatment essential. For example, some individuals with bipolar II might experience rapid cycling, which means they have 4 or more episodes of mania, hypomania, or depression within a year, adding another layer of complexity to their condition. Accurate diagnosis requires careful evaluation by a mental health professional who can distinguish between these types and develop a comprehensive treatment plan tailored to the individual's needs. Imagine trying to hold down a job, maintain relationships, or even just get through the day when your mood and energy levels are constantly in flux. The daily grind becomes a monumental challenge when you never know how you'll feel from one moment to the next. This is the reality for millions of people living with bipolar disorder. It's a condition that doesn't discriminate, affecting people from all walks of life, regardless of age, gender, or background. The unpredictable nature of the condition can make it challenging to plan for the future, make decisions, or feel in control of one's life. Simple tasks like scheduling appointments or making plans with friends can become sources of anxiety and stress. During manic episodes, individuals might engage in impulsive behaviors like excessive spending, reckless driving, or substance abuse, which can have serious consequences. These actions can lead to financial problems, legal issues, and strained relationships. On the other hand, during depressive episodes, they might struggle to get out of bed, maintain personal hygiene, or engage in activities they once enjoyed. The weight of depression can make even the simplest tasks feel insurmountable. This can lead to feelings of worthlessness, guilt, and hopelessness. The emotional toll can be devastating, making it hard to see a way out or believe that things can get better. The impact of bipolar disorder extends beyond the individual. It affects their entire support system, including family and friends. Families and friends often bear the brunt of their loved ones' mood swings, struggling to understand and cope with the changes in their behavior. They may feel helpless, frustrated, and unsure of how to provide the right support. It's important to remember that bipolar disorder is not a sign of weakness or a character flaw. It's a complex medical condition that requires proper diagnosis and treatment. It is a medical condition that requires understanding, compassion, and support from both loved ones and healthcare professionals. With the right treatment and support, individuals with bipolar disorder can lead fulfilling lives and manage their symptoms effectively.